Good day. We're starting a few seconds before our starting time, but we will catch up. We will have a little bit more than 30 seconds on the program this midday, but that tells you how eager we are to come to you with a carefully selected guest to be able to handle the issues for you this day. We thought we would do politics, but because of the gravity of COVID-19, we've decided to come back on it. And today we'll be talking about what is working and what is not, and whether foods help, foods in plural, help or in the fight against the COVID, which the government is engaged in. And for your information, the situation is still very serious in the world. We have about 2,861,597 cases in the world, that's worldwide, with 202,727 deaths, with only 802,774 recovered. The U.S. remains the hardest hit country with about 53,934 deaths, but Spain remains one of the most affected countries with on the European continent, with 223,757 deaths, cases confirmed, with 22,902 deaths. And this midday, we've decided to focus again on COVID-19, like I said earlier, with a nutritional biochemist with us on the program this midday, Professor Julius Oben. You're welcome.
Thank you.
And it's a rare situation to get you out of your laboratory, and we are grateful that you decided to join us on the program this midday. Our usual friend from the Ministry of Public Health, Dr. Eric Tandi, you're welcome.
Thank you, John.
And we want to appreciate your availability on CRTV in particular, because almost on daily basis you are on CRTV airwaves.
Thank you.
We have our editorialist, Tewi Lambif, with us on the program this midday. You're welcome.
It's a pleasure, John.
And we have an epidemiologist. He was here earlier on when we started this discussion on COVID-19. Today we have invited him to talk about where we are with this epidemic, which has become a pandemic, like he did explain last time. Dr. Asa Felix, you're welcome.
Thank you, Joe.
Okay. I would like, during the week, the presidency published the results of the Garbu findings, and the papers have been feeding fat on it. But like I explained earlier on, we will not talk about politics today. We'll talk about health, because if you are not healthy, you will not be able to talk about politics. So our health first. But what have the papers been feeding on? Emmanuel Avemnu.
The fight against COVID-19 in Cameroon continued to occupy the lion's share of newspaper columns, with Paul Biya equipping the 360 subdivisions with kits worth close to 3 billion francs CFA on Cameroon Tribune. To the Guardian Post, Biya offers 2 billion CFA personal support to save lives nationwide. The Chronicle Times writes, Biya offers over 2 billion preventive kits nationwide. Municipal Update sees Biya inspiring world leaders in containing COVID-19 at a time the battle against coronavirus deepens. On the Post newspaper, with donations of anti-COVID-19 kits here and there. Then Cameroon engineers develop ventilator prototype to fight coronavirus on the horizon. Parliament then wears in to support measures with 100 million CFA francs on Cameroon Tribune as a lawmaker proposes slash in salaries of ministers, GMs, MPs to contain COVID-19 on the Guardian Post. But the interest of the Post Weekender is on what it writes: COVID-19 pandemic sends government in search of cemetery space. Just when over 1,000 inmates are liberated from prisons across Cameroon, on the lone bilingual daily Cameroon Tribune. Then Biya cancels Labour National Day celebrations on the Post Weekender. To Municipal Updates, Labour Day May 20 celebrations cancelled to contain coronavirus, just in time for the AFDB to say that Cameroon to suffer least shock in CEMAC on the Guardian Post. before private media owners cry out to BIA for rescue as COVID-19 cripples economy on the Lone English Daily. Just when drinking alcohol may increase chances of catching coronavirus, WHO warns on the Voice newspaper. Results of the inquiry into the Ngarbu incident are then made public. Commission of Inquiry renders reports on Cameroon Insider only to receive the prescriptions of the head of state on Cameroon Tribune at a time government's finding implicates top military officials on the Guardian Post. Then BIA orders punishment for authors of Ngarbu massacre on the Chronicle Times before demonstrating impartiality on the Ngarbu incident on municipal updates. The paper goes further to give reasons why Ngarbu deserves a military base. But Wikuda president tells government, we do not want military base in Ngarbu. Then questions, will exhuming corpses resurrect the dead? According to the Post-Weekender. Just when BIA regime under pressure to investigate other alleged military excesses on the Guardian Post, same as UN demands full accountability on Ngarbu massacre on the Post-Weekender. Then Mincom adopts stringent measures relating to government subvention to private press on the Star newspaper as new Bamenda city mayor gets first baptism of fire with bikers confronting pleas over extortion on the Voice newspaper. And 2 are buried alive as fence collapses in Limbe after heavy downpour on the Star newspaper before customs seizes 210 cartons of fake chloroquine in Gaundere. Until I come your way again, this is your Hour with the Press.
Thank you, Emmanuel Avemui. And I'd like to begin with the epidemiologist, Dr. Asa. How would you assess the evolution of the pandemic in Cameroon today?
Yes, Joe, I think the pandemic or the epidemic in Cameroon is evolving quite surprisingly favorably for the country. Because a month ago, the statistics that we had in the country at that time had about 200 and something people infected. And when you looked at that data at that time and you plugged it into models that followed the evolution of the epidemic in other Western countries, a month later, that's today, we should have had about 25,000 cases in Cameroon. But we are still at 1,400, which means that the measures that have been put in place should be working, and working surprisingly very well. Now, why is it that these measures put in place are working? There are still a lot of unanswered questions. It could be because the measures are effectively being implemented. Social distancing is going on very well. Personal hygiene is well respected. But there could also be some counterfactuals that play into this favorable evolution in the country at this time. In the sense that maybe because the population is much younger than in the Western countries, people tend to survive better even when they have a symptomatic infection. And the data actually testifies to that, because the current mortality rate of hospitalized symptomatic cases in Cameroon is just about 7%, which is far way less than the global mortality rate, which is about 20%.
Okay. So would you say that the situation is under control, quotes and unquote?
Yes, I think that the situation is under control, not meaning that we would be able to remove the virus from the population. Because the numbers that we are talking about people who are symptomatic and they have tested positive, or contacts who have been traced and tested. But we don't really know the level of penetration of the virus in the community, because we don't have enough tests to do routine community screening, which would give you an indication of the number of people who are coming into contact with this virus, getting infected, but have a purely asymptomatic disease that manifests no signs and symptoms and move around healthy.
That sounds quite interesting, in the sense that in spite of the initial fears, we apparently, it's not only in Cameroon, but across the African continent, the situation is not that bad. In fact, like you said, the projections from Western governments made the entire continent shiver. And Tewi, I'd like to come to you. And when you look at, because we have as many as over 10 African countries that have this disease or this infection, but no deaths. You have Chad, Mozambique, Guinea-Bissau, Madagascar, Rwanda, Uganda, and a host of other countries that have had this COVID-19 or have this COVID-19 in their communities, but no deaths recorded yet. Is it because Africans are used to more difficult situations like the malaria infection? We know the world celebrated World Malaria Day the other day, and with a very high level of mortality on the continent.
Well, Joe, like the epidemiologist who is an expert in the domain said, our health system is not as operational as that in the Western countries. So some
you mean assessment modalities?
Yes, so some of these figures may not be very indicative of the reality on the ground. He just said that we are not doing systematic testing. And there are some, and we can't ascertain as to the penetration of the infection. So I think we need to, when we're making such declarations, they should be a little mitigated, because it's difficult to say. There are people who can get infected, get ill, and die without even being known to the system. That is a possibility. And I suspect there are many of such, given our reality on the ground.
Okay.
That said, we are in a situation where we're like swimming in the dark. We are in despair. And when you are in despair, you tend to trace or follow any track that can give you hope. Now, nobody knows, even the scientific community, where the treatment might come from. We tend to neglect our local realities. Okay? We have our African.
We will come to that. We will come to that. But you are talking about where the treatment will come. But we have cases of infections and symptomatic treatment, which have led to the infected persons being declared non- or corona-free. Is that not an indication that we have a reversal procedure in the treatment of these cases? You treat the symptoms and the person gets well?
Yeah, but it depends, as the epidemiologist said, on the age, the demographics.
And that, yes, that should be an added plus to us. Okay, I'll come back to you.
The population is essentially young.
Mm-hmm. But let me turn to Dr. Tandi. He just painted, I would say, a bright picture of the situation, bright, quote and unquote, because the projections from Western countries gave Africa a very bleak picture. But the way the situation is evolving, the disease hasn't hit Africa as much as it has hit Europe and America. But would you attribute this to the preventive measures which government has put in place, or the curative measures that government is targeting those who have been infected?
Yeah, thank you, Joe. All is put on the table as far as this is concerned. All measures that the government have put in place are actually working, as well as the behavior of the population as well. But it is too early, like I said, to conclude in Africa in general, because especially in Cameroon, we are about executing the decentralization management of the pandemic. And in the days ahead, we might expect to see an increasing numbers, because there's going to be mass screening, especially because the decentralization is not affected. You've seen cases that have been reported now from the Northwest region, because before
and to be more precise, the cases in the Northwest region, they got infected in Douala and decided to travel home, say they want to die home, so, and they might be given befitting burials, but that's not the case.
Yeah. So we are expecting that more robust method would be used, especially as far as the regions are concerned. But the population needs to continue to be vigilant and respect all government measures that have been put in place so that we could be able to disconnect this chain. I'm very happy because the population, almost all the regions are now being touched, except for the extreme north region that has not recorded any case. So the more the population is more aware, I think the better for us, and especially in the call center, the number that was given, we will continue to receive more calls. I mean, the population
Are they
is
reporting
getting
themselves, or they want to verify, get information about the disease?
They are reporting. Some are actually reporting themselves because it's one of the measures for contact tracing.
Okay.
And some of these individuals have actually been proven positive, although some cases have been negative. Again, also we encourage the population.
That's people owning up.
Yes, owning up.
I'm feeling bad.
Yes, and maybe due to the explanation of the indications that the ministry or the government has indicated, those criteria, they also respect the conditions. So they call and it's proven that it's positive. But then they have been taken care of. A lot of people have been taken care of, and they are out of the hospital after reporting themselves. So there is no need for the population to worry about the COVID-19, because the earlier you report yourself, the earlier you are being dictated, the earlier your condition can be managed, rather than staying at home and then getting complications and then complicating the whole system or the whole show for yourself in particular.
Exactly. And Professor Oben, when you listen to them talk, and how do you, and you look at what government has put in place, they call them the 20 commandments. The other day, Professor Chumbo was saying people call them commandments now, the 20 commandments. Would you have recommended that something be taken out or something be added to those measures elaborated or strategies elaborated to try to prevent or treat the disease?
Right, thanks, Joe. I think, well, in my opinion, the measures that government has put in place are appropriate and doing everything possible to limit or stop this transmission of the virus. Those measures, I say, working in a way because it has actually changed the way people look at things in Cameroon. And I don't think it will ever be the same again. What we have now, and one thing I don't think I want to advocate for is complacency, because once people hear that, oh, it's getting better, then become complacent. That is one thing that we have to avoid. We do not know, like anywhere in the world, the full facts are not there yet. It is a topic, ongoing research, and a lot still needs to be done, first of all, to understand the virus itself. That is the key thing. We do not know enough about the virus. Nobody in the world can claim to have monopoly of knowledge. I'm talking of nowhere in the world, of understanding how this virus works and how it's going to go on.
Okay, I've asked this question before, and I think I should ask you. Do you believe with the theory that it escaped from a laboratory somewhere?
Well, Joe, I don't think, this is the time to worry about where it came from.
Okay.
As of now, we should look for solutions to a problem. If it came from a laboratory, if it's natural, from mutation, there are all sorts of theories out there. But I think the key thing for us now is finding solutions to the problem. It's important to know where it came from, because it will help solutions.
Exactly.
But for our society, Cameroon now, at this point, I don't think it's a priority.
Okay.
The priority is looking for solutions.
Yes. Dr. Asa, where are we now in terms of the transmission? We have people have come from outside. We have stopped the entry of flights and blocked our borders, which means that the rate at which we're moving now, it's community contamination, right?
Yes, Joe, there is actually already community transmission of this virus in Cameroon. Transmission, meaning it is transmitted from person to person within the same community. It is not only imported cases. Like Eric said, in some areas in Cameroon, they still have importation of cases, like the cases reported in the Northwest region. Country. But as the epidemic would go on, if these people have not respected social distancing, have not isolated themselves correctly, if they have come into contact with other people, you may get a community transmission where these people would transmit the virus to other people within that community. And then that's how the spread would continue. But in terms of the epidemic curve, once the virus gets into a community, especially this particular coronavirus, the way it behaves is strange. And it can move very fast between people, even people who are asymptomatic, meaning it would transmit. So where the emphasis is put is trying to contain this transmission, to slow down this transmission.
Okay, the preventive mechanisms.
Yep. So you would have heard of, once the virus gets into a community, at this moment, it's difficult to say you can take out the virus. It would stay in the community, but you want to slow the progression. I'm sure you've heard about flattening the epidemic curve.
Yes.
You push the curve down so that you can, the symptomatic cases which would occur by a slower transmission would be sufficient to be handled by the healthcare system. Okay. Because if you don't put those measures and make sure that they are effective, then the epidemic curve stays very high up. And so you get an influx of people into the healthcare system, and it can crash the system. Okay.
That's very important. And there's so much complaint in the community about accompanying measures. And people are saying we've been asked to stay at home, schools are not on. And a lot of complaints about, especially from the private sector, about salaries and bills. Tewi.
Yes.
Government was studying the accompanying measures.
Yes, and I must confess here that the government needs to be one step ahead. This is a phenomenon that you handle it from a holistic approach. You give a holistic approach. You don't just look at the medical aspect of it. It will not solve the problem because its ramifications go beyond the medical, beyond the health. And so elsewhere, governing is anticipating, is preempting. You don't study a situation when it is at hand. You anticipate. You try to put in measures that would occur. You don't wait for the situation to degenerate. So what I'm saying here is that elsewhere, the responsibility of all the governments is, in as much as it is to bring the virus under control, it is also to take care of the population, of the other issues that have been engendered by the pandemic, economically, socially, culturally, otherwise.
Okay.
So what I'm saying here is
you've made your point.
There is what we call the BCP or the BCCP, the Business Continuity and Contingency Plan. You don't put in place a business contingency and continuity plan when you are in crisis. You anticipate on that. You put in. It can no longer be business as usual.
I see what you're saying.
Yeah, what this means, if you can give me just a few seconds to explain furthermore, what this means is that whether you are in the education sector, it can no longer be business as usual. Whether you are in the economic sector, it cannot be business as usual. Whether you're in the social sector, it cannot be business as usual. You adapt to a changing time. You must have the ability to manage a crisis. A crisis means that you multitask. You go along with multi-stages at the same time. You don't conceive, give your time to evaluate the conception, then you start executing, you give yourself to evaluate the execution.
Okay, which means you have to go as fast as possible, go holistically. And maybe you buy what Ugandan president said in his own move that we'll do business
I'm afraid we're not doing that very well.
Okay, all right. But let's hope that water is available, electricity is available, and that the people will be able to use that. I'd like us to have a break and go over to Douala, where the Archbishop of the Douala Archdiocese has been able to use his own knowledge, 30 years of research, personal research. I know all of us here are Africans, and we've at one point or the other taken our roots and our leaves to help ourselves. So he came up with something which is helping people, and CRTV went and met him. And our reporter from CRTV Douala, Alphonse Abongo Achu, met the Archbishop and brought back this report for CRTV.
Archbishop Samuel Kleda has to his credit 30 years of medicinal plant research. Over these years, the man of God admits having discovered concoctions that treat ailments affecting the human respiratory system. The new coronavirus has given the prelate another challenge, which augurs a glimpse of hope. Given that I already knew the plants according to the symptoms of corona, I have simply put together these combinations, prepared them and given to persons with the symptoms, and they were relieved. My pleasure is that those who take the product are well, so I'm satisfied. The Archbishop attests that health workers in the Douala Archdiocese who contracted COVID-19 have been relieved by the medicine he discovered and offers free of charge. Some nurses who had respiratory problems because they came in contact with COVID-19 patients took the product. Afterwards, they were fine. All we want is that the persons should not die. For now, the Diocesan Health Department is charged with the follow-up of these patients. I work within the framework of health. Given that we have our health services, the person who follows up the patients is our Diocesan Health Services Coordinator. He is a medical doctor. We are not illegal given that we work as a health structure. This also is the Archbishop's token to the collective national effort to put an end to the pandemic.
That sounds interesting, isn't it, Professor Oben?
Yes, Joe, that sounds very, very interesting.
And it looks very African.
It is African, and I think that is something that should be encouraged. What the Archbishop has actually come up with, find like all the different things that are being tried now all over the world, including what is coming from, we call it the medical world. They're trying things to solve a problem. The Archbishop of Douala has actually put something in place to try to find answers or solutions to a problem. This is what is generally called alternative medicine, which should not at any point be thrown out of the window as being bad because it's African. It is something that needs a bit more research to be put into it. Clinical trials have to be done for any such concoction put out to be able to conclusively say, this works, this doesn't work. The Archbishop has put out something that he believes has helped people with the condition. I think it is now for the scientific world to take the next step. What is in there that makes this work, if it works? And I think that is the approach that we should take.
Now, he's not alone. There are so many of such situations back in our neighborhoods, and which many people are asking, why has Africa not been able to exploit the rich flora which it has, to be able to come up with something that can help not only the Africans, because remember, medicines started on the African continent, the old Egypt. Our pharmaceutical industry is still very weak.
Yes, true. I mean, our pharmaceutical industry is very weak. I mean, just to add to what the Archbishop actually did, we have actually put something together ourselves in the University of Yaoundé 1.
Okay, I'll come to that.
Which I know you will come to
yes.
At some point. But we have to know the basis of medicine. In those different concoctions, are there active ingredients? Because these are the same active ingredients that are purified, in some cases, that are sold as medicines. So why not?
Okay, I'll come to you shortly. I would like you to react to what the report from Douala, Dr. Tadi.
Yeah, I think the Archbishop is trying his best in order to project what he has discovered. But within the Ministry of Public Health, I think we give also, according to the organigram, there is a section for tradi medicine, and which is still ongoing. You know, we try to integrate the functionality of this service. However, with African plants and other things, it works with the Ministry of Research, scientific research. And the issue here is how progressive this research can be, especially on the scientific scene, you know, before we generalize something. Although I'm much more whole on ethnicity and certain specificity based on region, because the human system is a little bit different. But following international norms, we have to take each research very serious. Before we draw conclusion to generalize it, it needs to follow a protocol.
Okay. What you say is extremely interesting in the sense that when it comes from the West, we embrace it. But when it's coming from Africa, we begin to put reserves. Why that?
Well, Jody, it's simply...
A complex?
No, not a complex. It is simply because of what people think that nothing good can come out of this dark continent. That I may be a little, simplistic there, but the truth about it is that there is. What does it cost to find out if it works?
That's it. That's the question.
Just simply get. He's speaking from empirical evidence. He is not a scientist. He simply says what the Archbishop said. We had given my concoction to, and he had a case.
And he hails from a region where we have a lot of respiratory diseases.
Yes.
And so as growing up, he certainly would have followed what his parents were doing.
We must be cautious. He is not saying that he is treating the coronavirus disease. He is saying that with the concoctions that he made, he gave it to somebody who had the symptoms, and the person was relieved. It's very clear. It must be taken. He is not saying that I've discovered medication for coronavirus. If we must be cautious.
No, that's true. And that's what the scientific world is doing. So they are not treating corona, are they? They are not. Dr. Asa.
They're managing it.
They are managing.
They're managing it.
Yes.
So you why don't you just, on the basis of empirical, leave your even a crisis? I can say, like I said, when you are managing a crisis, it cannot be business as usual. Whether you are in the medical field.
Okay.
There are steps that you fast track.
Okay.
Yes.
Dr. Asa?
Yes, I just want to add a little bit to what has already been said on the panel, that in scientific research, or in the world of research today, internationally accepted, there are certain steps that must be followed before you generalize findings, particularly when it comes to drugs creation, drug testing, etc. Because in basic pharmacology, the first principle of basic pharmacology is primo non nocere. First, do not harm. It is not useful to give medicines to people and treat them of their disease and make them die of the medicine. So you want to make sure that the medicine, you know the medicine that you are giving to your patients or to the people, you want to make sure that they have no unwanted effects. Because there's a classical story from the middle of the last century about this drug thalidomide, which was given to pregnant women to relieve them of nausea of pregnancy. But some years down the line, even though this medicine helped the women significantly in stopping the nausea of pregnancy, it led to malformation in the children who were born from women who took these drugs. So putting a drug out there is not something as simple as people think. I'm not saying that the findings from the Archbishop are unfounded. Yes, he could have helped symptomatically the people who received his medicines. But then we need the Archbishop and other scientists need to look into this in more detail.
Yes, there's one thing in what you have said, and that's the skepticism that comes with research and the development of drugs. But one thing what one would keep asking is, whether that skepticism is not because that research and that finding is coming from the African continent. Because we have Chinese traditional medicines which we are embracing. I remember what they call Jensen is what my father used to treat his stomach disorder with. But when it comes from the other side, we embrace it as if it's some new finding.
No, I don't think it's a problem of coming from Africa. I think it's about following a correct methodology. Chinese traditional medicine is heavily researched and widely published. So you really cannot equate. I mean, there are certain people in China as well who would develop something, and if he has not gone through the same rigorous process of making sure that it will not harm people, even if it has benefits, and then it should not be accepted. But then, if it has benefits and it doesn't harm, or you can accept the level of harm that comes with the benefits, and then it should be generalized in that case. But then there are steps to doing that.
Okay. Tewi?
Well, in as much as I do understand what the epidemiologist is saying, I beg to differ in the sense that he is taking what would normally obtain in a normal situation. We are operating, we are in what we can describe as a crisis situation. And that is what I say. In a crisis situation, it cannot be business as usual, be it medical.
All right.
You cannot say we must do this step.
You have made the point.
Now, there are some of these steps, Doctor, that you can fast track.
Okay.
Yes, fast track.
Yes, you can fast track.
Yes.
So
we have understood. We've understood your point.
This thing of saying that
we've understood your point. Yes.
It must follow the steps.
Just go ahead. Yes.
If you do that,
it's okay. Tewi. Now, Dr. Oben, or Professor Oben rather, that's. No, it's okay. Your microphone is not on, but you'd use the other one. It's still good. Now, that's this problem which has cropped up because of the current situation, eating of foods and having the tisanes and so on and so forth. So, what do we need to know? What does the public need to know about what to eat and what to discard at this particular moment?
Right. Thanks. I think before I actually answer that, I want to touch on a word that you mentioned, complex.
Okay.
Do we have a complex? Yes, we do. Yes, we do have a complex.
All right.
That is the truth. We have a complex, not only in terms of looking at our own research, but even in terms of what we eat. In terms of what we eat, we embrace foods from all over the world. We think that it is the thing to eat foods from Asia, for example. You need to go to some Asian restaurants in Yaoundé at some time, and there isn't anywhere to even park to go in to eat. These are foods that we are not used to eating. And my view of science, my view of life is that every environment is complete, i.e., you have things in that environment that you need to eat to stay healthy. You have things in that environment that you can use when you are sick. That is what we talk about, the completeness of nature, the completeness of the world. We eat foods that come from Asia, that have spent ages in refrigerators, in freezers.
In Europe and from the Americas.
I'm talking of here, a country which is blessed with so much food of all sorts of varieties. A country where just the foods that we have here in Cameroon, if we follow what we call balanced eating, there wouldn't be any need to worry in times of crisis like now. Because the key thing and the guide for what we should be eating at this time is that eat as many colors as is possible.
Now, when you talk about eating colors, what does that mean? Color pencils, color food? What
Joe, when you go to the market, okay, and I'll use the market that I go through sometimes, Machine Fundi.
Okay.
The amount of fruits and vegetables sold in that market is enough for anybody in Yaoundé to have a balanced diet. Just go there and say, well, what I'm going to do today is I'll buy a fruit or a vegetable of a different color. Don't buy any two things of the same color. There's green, there's yellow, there's orange. Just buy the different colors. Don't worry about, if it's healthy or not. buy the different colors, go home, make sure you eat those colors, and you'll have all the nutrients that you need to stay healthy. That's
Okay.
an easy guide.
That sounds interesting. So what should we eat now and what should we not eat now?
Well, at every time, and I hope that this epidemic is going to change our way of thinking and our approach towards food. The point is not to eat to be well or when you're sick. The whole idea is to eat to stay well. What you call wellness.
Yes, that's where I'm coming to.
You're already there, Joe.
Yes, and when a lot of people talk about foods that boost the immune system and those that help you to stay healthy, what should we be gearing at now and what should we do?
If at any time we had focused on eating a balanced meal, which is what was lacking, because you tell the person on the street, eat a balanced meal, that doesn't mean anything to them.
Exactly.
That is why we've come up with this, and it's not just us, all over the world. It said, eat as many colors as possible and you will have a balanced meal. What that means is that you have the macronutrients, which is what you require for the energy, as well as micronutrients, which you require for the functioning of the body. Obviously, there are some nutrients that have been found with a lot of scientific backing that help the functioning of the immune system. And, just off the top of my head, the vitamins. Vitamins A, B, when you talk about B vitamins, it's a whole range of them. There's B1, B2, B6, B12, all of that. B6, for example, is known for its properties in helping the immune system. Zinc, very good for the immune system. Selenium, very good for the immune system. And all of those things are found in the common foods that we eat every day.
To be more concrete, what then should people do at this material moment? You were talking about the B. So where do they find those vitamins so as to stay healthy or boost their immune system so they can face the coronavirus?
Eat your fruits and vegetables on top, over and on top of what you're used to eating. And please, eating well does not mean need to have the money. No. Fruits and vegetables in season, that is what we need to eat to our normal everyday diets now. The only advice for those who are not used to having fruits and vegetables, more than ever, we need it now to help our immune systems.
And those are?
For example, the spinach, which is high in vitamin C, key for the immune system. You have spinach like all the other, green vegetables. Citrus fruits, high in vitamin C. You have melon seeds, the egusi, very high in zinc. There are things like garlic as well, because as well as those things to boost the immune system, you have foods with scientific backing that are antiviral and antibacterial.
And these foods are?
Foods, like the garlic. Everybody thinks about garlic and ginger. The prices in the markets have gone over the roof because this actually have properties which are known to be antiviral. So those are the things that, our Cameroon spices, the Cameroon cuisine is just wonderful. There are so many spices there with scientific backing, peer-reviewed papers that have actually come out to show that this particular plant, this particular spices in our diets have this effects that could be useful to the body at this time.
Be concrete.
Be concrete.
Yes.
I'll use the example of what we are doing presently, which is the PATYCHOU soup. Okay? Sauce jaune, yellow soup. That has a lot of ingredients, spices inside there that are known to have antiviral effects, antibacterial effects, antioxidant effects. Just your PATYCHOU soup. But what we've done is fortified it by adding things that normally would not go in there.
Like what?
like the melon seed, egusi, which normally will not be in the achu soup, but because of its high content in zinc, and it's something that almost every Cameroonian eats, we said put it in there for that property, that functional property of providing the zinc, which is not only good for your immune system, but has scientific backing showing that zinc actually inhibits RNA replication, which is viral replication.
Okay, now, what if you eat the achu and the achu soup and you have your lump of egusi besides? Would that be helpful, or you need to put it into the soup?
Well, you see, we are looking at a situation where there is in Cameroon cultural differences. There are things that some people don't eat.
Okay.
And things that people eat. But in terms of an illness, see that food as a medicine. And everybody will eat it.
Now, for those who don't eat the achu soup, what's the alternative they can have to be able to have a complete immune or fighting system like what you've just put?
Right. I mean, it's interesting because I was having this discussion with the Paramount Chief of Manfe yesterday, Chief Dr. Oben, and he said, Julius, haven't you found anything in our meals here that have all the spices? And I told him that, of course, because the spices in the Manfe, they call it PATYCHOU soup. Some of those spices are actually used and have scientific backing.
Now, okay, you just talked about the spices that go into the achu soup. Many of the spices are used elsewhere. Can you give us the names so that people can know that this is what we need to be eating at this time, especially targeting viral attack, trying to inhibit the replications of viruses?
Right. I think, Joe, to be fair to the, to the non-scientific committee, I would say, I think tomorrow's papers will carry some of those things because they are traditional names and scientific names. If I say, for example, Dicrostatis glomerata, it wouldn't mean anything to the person on the street.
Exactly.
But those are spices that are used every day. So all what goes in there have actually been, written up with the commonly used name as well as the names in different dialects.
Okay.
And that is going to be out in the public. I mean, if there is time, we'll give the foundation website. Okay. Which actually
in other words, we can have, if you just put it as you put it simply, what the ingredients that go into the achu soup are very good to be eaten at this particular time. Now, there was so much talk about tisanes. What should we take and what should we not take at this moment?
Right. Tisanes are good, mainly for the flavonoid content.
Can you explain that?
Right. There are actually components in most of these teas that have properties that can stop or reduce oxidative stress. Oxidative stress basically is what the body will experience. Just the fact that we are living. The normal metabolisms will generate different compounds which could put stress on the body if not taken care of. Okay, these tisanes, there are different combinations there. I'll come back to what I said. Yes, what is the scientific basis of these tisanes? The scientific basis that we have as of now is the content of antioxidants. So the advice, because you hear all sorts of things. You should drink hot fluids.
Yes.
Okay? Mm-hmm. And the person on the street can interpret that to be that the hot water, the hot fluids will kill the virus. The temperature which will actually kill the virus is not a temperature that the human, gastrointestinal tract can cope with. Okay? So we should stop looking at what happens inside the test tube and comparing it to our body function.
Digestive system.
Yes. Now, very, very...
Okay. There are times when people combine so many teas, fever grass, lemon, pineapple peelings and so on and so forth, and then honey. Can the body make the difference between all the ingredients that have gone in and separate them in the body and give every part of those ingredients or the vitamins what they are supposed to do in the body? Can the body make that difference, even when they are combined?
Yeah, the human body is very, very complex, but it is a very, very organized system where the different organs of the body will take and use only what they need and what they can metabolize. So no matter what combinations come in, the body is able to distinguish, but we have to be careful because sometimes those different combinations lead to a situation where one component or one ingredient in there actually counteracts another one.
Okay.
And, you know, as I said, this whole COVID situation is providing a lot of help, and life is not going to be the same after this. The Cameroon Academy of Science has actually set up a food and nutrition task force against COVID to actually come up with concrete solutions that will help.
We will come back. We'll come back to that. Maybe a quick reaction before we get Teke.
Yes.
On what our foods and our artisans.
Yeah, if there's something I should appreciate about COVID-19 is the gradual change of behavior of the population, especially when it comes to meal. A lot of Cameroonians now are turning to our traditional meals and culture and taking even tisanes. It means we've started living away from Western foods and concentrating on our natural resources and food. Okay. But just to add to what Prof said, I think it's important to note here that some patients or some people have specificity because there are people who are allergic to certain food stuff or due to health reasons, they have to stay away from certain food stuff. So this category of person need to be very careful, not just to listen because we've recommended PATYCHOU soup or some elements and they now alternate what has been recommended for their health and they go in to consume some of these things that can create them more problems. So what is encouraged here is to live healthily and eat what is useful that is specific to your condition.
The individual.
Yes.
Tewi?
Yes, so I just want to take what one of the persons who has been cured, he's been on the media. He's been on the media, and he said on the news. He said that he had the infection, and immediately that is an example that immediately he got into contact with the competent medical services, and at the same time, he was taking his African herbs and whatever. So it boils down to this thing.
A combination of
it. At moments like this, we should try. What it doesn't cost anything. Right. We should try. And we should not neglect. We should not have any complex.
Okay. Elvis, I'll come to you, Dr. Asa, shortly. Reactions online, we are bringing live on Facebook.
Quite a good number of them, and some are still coming in. We might not be able to read all. Ulrich Divane says hand washing is good, but let's look at Madagascar. Tanjong Nuza Queen says the campaign carried out in different communities is really working, but his worry is now how the figures keep rising instead of reducing. While Usman says with over 697 recovered cases, the situation is under control. Joachim Augustine says social distancing still remains a challenge, with people still very close to each other in the market, and he thinks it's high time for the government to look at other examples in other countries. Jesse Kunang says his suggestion is that they should bring on board genuine traditional healers to accompany the medical expert. While Akong Foba Levinus says let government call for a total lockdown and assist the population with basic needs. Joe Waters says the use of mask is working because the increment of the ratio of patients is no longer geometric. While Ngu Pythagoras is asking what it takes in terms of cost to treat a patient carrying COVID. PATYCHOU says there is a global fight and all hands should put on deck to eradicate the illness.
Maybe that should be the last one.
Moa Michelle is also asking what it takes to treat the patient, and Young Stanley says only essential businesses and offices should be open during this period of the fight against the pandemic.
Thank you very much, Elvis. You'll be back next week with another in a series of reactions to our program. We are moving gradually towards the end of the program, and you just followed Professor Oben there about the feeding habits and what our foods are giving us. And one of the things which many people are asking is, those of people who are staying at home and who are not sick, staying at home can cause people to fall sick because of their feeding habits. So what should people do and what should people not do now that they are restricted from going out? That is, you must go out only when it's necessary.
Yeah, Joe. What Prof said is really good. I just want to come back on one or two aspects so that is clear, because I noticed you kept probing Prof to name some foods. And now, Cameroon is a very diverse country. Okay, not everybody knows what is achu soup, for example. But the first point which he made about eating what is around you and varying what you have around you is very important, because all over the country people have diverse meals. And these meals taken from the natural environment, if you eat a balanced meal, you have all the necessary macro and micronutrients which you need. And the problem at times with calling a name is that you get people rushing to overload on a particular thing. Mm-hmm. But like Prof said, the human body is very complex but well organized. If your body needs 5 milligrams of potassium, no matter how much quantity you eat, it's going to take just the 5 milligrams and use. Okay? With the added risk that some of these things can actually even overload and cause problems. Okay? Mm-hmm. So the take-home message should be that people should eat normally what they eat and make it more balanced in terms of eating fresh foods, fresh fruits, vegetables, spices in normal quantities, without necessarily thinking that if you eat a handload of a particular thing, then it becomes a medicine.
Okay, that sounds interesting. And maybe you conclude? Okay,
so moving from there, I just want to say people who stay home now face multiple challenges. One, in terms of access to food. Two, in terms of physical inactivity, because if you are quarantined at home or locked down at home, you don't exercise. Because exercise is also very useful for oxidative stress reduction. Okay, so people staying at home should look around them. If you don't have to go out to Paku Vita to exercise, you can do stretches in your living room. Okay, and fortunately, unfortunately, our electricity supply is not very stable. So it means that people cannot actually stock up on food in the freezers, because it could all get bad in a few days if you don't have power supply. But we have readily available markets all over the community where you can go and source for fresh food.
And if you're going, wear a face mask.
If you're going, wear a face mask and make sure you respect hygiene, wash your hands, and maintain a reasonable social distance, which currently is prescribed to about 1.5 to 2 meters gap from other people around you.
Okay, Tewi?
Well, I just want to say that this is a crisis, and a crisis should be managed as such. A crisis cannot be managed the way some of our people in the front line are managing it. Okay. To them, it is business as usual, and I disagree with that. Okay. It cannot be.
Dr. Tandi?
Yeah, I will encourage the population to continue to follow strict preventive measures and take care of individual protection, and then avoid any misinformation, especially fake news that circulates on most social media, and stay at home as much as you can and do the exercise at home and stay healthy.
Okay, Professor Oben, maybe advise on what people should do at home now in terms of their eating habits.
Yes, what people should do at home, first of all, because it's not, to stay healthy is not just the eating. Exercise is a major part of staying healthy. And I mean, it would be good if, for example, CRTV, you have programs. I know there used to be there where you actually have an exercise.
Indoor
so people can actually follow those things. It is very important because we don't want to come out of this crisis and go to an obesity crisis due to lack of exercise. When you're at home, please, as much as possible, eat fresh foods. If you have, foods that you actually buy preserved from cans, you take the cans, you read the label. If there's any word on that label that you cannot read or you cannot pronounce, know that it's an additive. Stay away from it.
Okay. All right. Thank you so much, gentlemen, for coming. We hope that you got the message and that the most important thing is for us to stay healthy and to be able to live or outlive COVID 2020. And we will live to tell the story for those of you who would be able to, those of us who would survive this pandemic. It's ravaging the world. And like I said earlier on, about 2.8 or 2.9 million people have been infected, with over 202,000 people dead. Until when we come your way again next week, stay with CRTV if you can. Tam Weekend will be following on CRTV, and the news comes immediately on CRTV News. Good day.
CRTV News, ici, toute l'info.